Arthritis is an inflammatory condition of the joint, and when you have this inflammation, then it's going to primarily present with pain, and besides pain, you can have an increase in temperature around the joint. It could be swelling, there could be fluid presence in the joint, and of course, if it gets extremely bad, then you can become handicapped because there could be some permanent change in the joint. Just to classify arthritis, the common one is osteoarthritis, because as you grow older and you get heavier, the body decides that it requires more disposition of calcium to sustain the weight. So it puts together osteophytes and things like that, that sort of gradually disrupts the anatomy of the joint, and then there will be some amount of disfigurement and the joint doesn't work as it's supposed to. Then you have autoimmune issues like rheumatoid arthritis. You can have psoriasis, that also gives you arthritis, psoriatic arthritis. Then again, a major component is post-traumatic arthritis, because once you have had trauma, you have had an accident, you've broken a bone which affects a joint. When healing takes place, there's always more sort of reinforcement with calcium so that the bone becomes more rigid. This is part of the healing process. And when you always have more deposition of calcium, then you find that it sort of works against the mobility of the joint. The joint is no longer fluid. The range is reduced because there's some sort of impairment in the joint itself. And then there's gout, where you have high levels of uric acid from the kinds of food that you eat, and that gout also the uric acid crystals actually mineralize in the joint, and then they prevent the joint from moving normally. So the cartilage gets worn out and you have pain when you move the joints. Most of the time, the symptoms are primarily pain. Of course, then there will be also loss of mobility, because the range of movement would probably reduce. So initially, of course, we manage the pain. Most of the time we use common drugs like Panadol, non-steroidal anti-inflammatory drugs like Voltaren, Ponston. Then you have those that don't make you gastric like Arcoxia and Celebrex. And of course, if the pain is worse, then you may require some surgery. There are a lot of other associated therapies that you can actually enroll in, like physiotherapy. If you go to a better physiotherapy center, they're actually well equipped. They have stuff like laser, heat treatment, ultrasound and things like that, where they can actually reduce the inflammation, the swelling to a large extent, and then strengthen the muscles around the joint so that the muscles now take over. And when the muscles take over, then the pain that comes from the joint actually reduces, and you're able to overcome a lot of the dysfunction of the joint by exercising and getting your physiotherapy done.